Thank you, Mr. Speaker. Mr. Speaker, first I would like to say that the governor's speech was detailed and he really touched in each and every department. But on personally my side, I wanted to hear a lot from from the some of the departments, especially like health. I've seen governor has really talked about what has been done and what the department is going to do in future. But personally, I wanted to hear, especially as far as cancer center is concerned, because Mr. Speaker, in this country, I got an opportunity of serving in the same department and serving the community of Mandera County for the period of since 2015. Mr. Speaker, and have really served those patients suffering from the cancer for all those time. Mr. Speaker, each and every disease, what matters a lot, it is diagnostic. And as far as because here, Mandera Referral is one of the hospitals that normally serve the three countries, Kenya, Somalia, and Tanzania, and Ethiopia. Mr. Speaker, lacking a cancer center in such a big town or a big county is very unfortunate. Therefore, I just wanted to hear from the governor if maybe there's such plan for the county I haven't had. Secondly, there's an act that was asserted on the 1929 October 2023 at the National Assembly. NHIF been changed to social health insurance, and there's from the governor's speech, there's a 21,573 vulnerable people who have been from Mandera County who are made to benefit from the NHIF. And the NHIF, they have shifted to the social health insurance, which is a bit, in terms of service, is a bit different from the NHIF. And this one also, I think people at that department, they could have guided governor more further, because I know those people are confused, because the social health is a bit different. They normally start for the primary health care. There's a level 1, level 2 before you go like NHIF direct to any level that you want. If you go to social development department, I really recommend the governor, especially as far as the youth concerned. I've seen in terms of youth, in terms of sport, talent development, focus on sanitation and sport participation. I know there's a lot of, there's some youth, a group of youth who went to Nyeri to participate in several games, not only Nyeri, even in Meru. Therefore, I also wanted to hear a governor's tournament from the governor, at least for youth. I know many youth are engaged in drugs and all. We want them at least a tournament that can go for the whole year. Then the final being done. That do. Captured. Okay. Then, if I will go as far as social concern, social service management devolved unit and cohesion is concerned, Mr. Speaker, on page 27, governor has talked about similarity through the Department of the Public Service, where they want to modernize, department want to modernize HR records. Mr. Speaker, there's a group of people who are giving service to our community that we have forgotten, especially the cash workers. As we speak, Mr. Speaker, especially cash workers from Mandera Referral Hospital, they haven't get their due for almost 5 months. Those are the people that they have children, they need basic need, food, shelter, and right now we are approaching the month of Ramadan. And those cash workers, some of them, they are working over 20 years in Mandera Referral Hospital or any other department. Mr. Speaker, for the further me, I will recommend, or I will, especially for as far as the department is concerned, the department should, if possible, if they are modernizing their HR records, at least as long as those guys, they will be paid from the AIE or from any other source that's coming from this county, they will be if HR will be modernized, they will be part and parcel of the like other employees and get the benefits like other community. Anyway, and I would like to say governor's speech was well elaborated and he has touched really on all matters that that's concerned from each and every department. I support the motion. I support any